is nobody for the 216's budget public hearing, we will now close the 216 budget public hearing. Next thing on the agenda is public comments. Debbie Pavlik would like to speak. Deb?
I forgot to ask Melanie to get added to the agenda, so ask Bill to join me. I just wanted to give the county board a quick update. In the spirit of Veterans Day, the Commission on Aging for the last couple of months has been discussing an update to a local policy related to serving meals for both at the meal sites and for home delivered meals. And at the last meeting, they adopted a local policy that would allow veterans under the age of 60 to eat at the dining centers or to be on home delivered meals program for the suggested donation rate. So we're very excited about that. We don't think it's going to attract a large number of people, but it is an opportunity for those that might be in need of a meal or socialization or things like that. So hopefully you'll spread the word out in your communities and let them know that they're welcome to come to the sites. It is a little bit different than the confidential donation that our current participants 60 and older are able to participate in, and the difference is that we expect the contribution of $350 from the veterans under 60, whereas with those that are 60 and older and their spouse of any age, they have the opportunity to make a confidential donation of any amount, even though we set a suggested donation rate. And then the one other aspect to this would be that if for any reason down the road we were to make a decision to reduce service because of funding issues, we would have to eliminate this policy because we cannot deny somebody 60 and older or their spouse of any age a meal to serve somebody under the age of 60. And I do want to add that this is for veterans under 60 and their spouse of any age. And of course, veterans over the age of 60 already qualify. So Bill, and also Bill and Fred Kaiser, who was the previous veterans officer, and then Shelby Lemke from Poisippi, who was the spearhead on this whole project, and then Valerie Ladwig worked on this as a little committee to put this in place. So you want to say something?
Just if you have any questions on the process, happy to address it. Honestly, Deb's team did a bang-up job on putting this together, and if you've ever met Shelby, woe betide anyone who says no. So really glad it went through, and really looking forward to seeing more veterans out there. I don't know if I can eat every day. That'd be $350. Boy, that's saving me some serious money.
Thank you.
Okay, thank you, Deb. Bill. Next thing on the agenda is unfinished business. Discussion and action item. Direct deposit payments for county board supervisors.
So at the last county board meeting, as part of the compensation package, the board had voted to clarify the existing policy. That the existing policy is that everybody who receives a paycheck from the county through payroll gets that direct deposit. That had been in the past, county board supervisors had not been part of that policy, and so it was voted on as part of the compensation package for the next term that would be required direct deposit. That was asked to be brought back to you today, and so we're asking you today to determine whether or not you want county board supervisors to be part of that policy or not.
I think I brought that to your attention, Ms. Zolski, about that because it was not an item on the agenda for last month and we took action on it. So I feel that was an error on someone's part, and that's the reason I contacted you about it. And I'm glad to see it's back on the agenda tonight.
Discussion, comments? If you have to, everybody else should have.
Well, I guess that
We need a motion to pay, yeah. There's been a motion made.
I'll second it.
Motion made by Everett, seconded by Bob, to approve the direct deposit payments for county board supervisors. Is there any further discussion or comments on this?
Is it because, it did pass last time, but because of the question that it shouldn't have been brought up, it,
Wasn't on the agenda. Is
There
what
was a difference of opinion, and Supervisor Heisey and I had that discussion. He felt that it should have been something separate. I felt that it was part of the compensation package and it was okay to talk about. But because there was that difference of opinion, we decided to bring it back for clarification.
Okay, once again, there's been a motion and a second. All in favor?
Aye.
Opposed? Carried. New business, reports and presentations. Child Support Office Annual Report. Kim?
Good evening. Okay, I wanted to go over some things about my department. So here's our organizational chart. We are overseen by the Bureau of Child Support in Wisconsin here. And then we are also overseen by the Federal Child Support Office of Child Support Enforcement. In my office, I am the director, and we have 3 specialists, and then our corporation counsel is our legal counsel for our agency. A little bit about what we do, paternity establishment or legal fatherhood. So what we need to do is make sure that every child has a father's name on the birth certificate, and we will get these referrals for people who are receiving public assistance benefits, or somebody can apply for our services. A mother or father can come in and fill out an application to assist them in doing this. The primary reason is to establish custody and placement rights. There are other benefits, financial and non-financial. Okay, once paternity is established, we would request a child support order if the parties are not residing together. We would get a medical support order and any repayment for any costs associated with bringing the case to court. Placement of the child is addressed, private health insurance coverage is addressed, and we would take in consideration both parties' income in certain circumstances. Wisconsin is a percentage of income standard, where there's an expectation that both parents share their income towards supporting the child. So collection of the child support, we do an automatic income withholding if someone's employed. There's 5 places that we commonly would withhold from. Employment is the most common, unemployment, Social Security, retirement and disability benefits, not SSI or supplemental security income is what that's called. Workers' compensation, if they've been hurt, we can withhold from their benefits. If they're not employed or if they're self-employed, they can make payments on their own, and all payments are receipted through the trust fund in Milwaukee, Wisconsin. Enforcement tools, these are automatically done if they meet some thresholds. So there's liens, tax intercept, denial of passports. Enforcement warning letters will be generated by the state automatically, and also interest charges monthly if they become behind by at least 1 month's worth of support. So we can initiate some enforcement ourselves. Most commonly would just be increasing the income withholding to collect on some arrears if they've fallen behind for whatever reason. We can do an account seizure if we get notification from a bank that they have a large lump sum. We can deny their licenses for hunting, fishing, driver's license, or professional licenses. We can also bring them to court for contempt, and the last resort would be a criminal non-support referral to the district attorney. why what we do is important. Well, we like to see people have private health insurance coverage to lessen the need for public assistance benefits such as Badger Care coverage. 42% of our cases right now have private health insurance established. Child support would also reduce the need for state aid money such as food share. If someone's receiving W-2, some of that money goes back to the state. We also report things if we find that someone's living in the home we haven't reported to the public assistance. We often report that so that we can prevent fraud. These are our numbers. Our federal fiscal year runs from October 1st through September 30th of each year. So the 2015 federal fiscal year just ended for us, and we had 1,167 cases. As of September 30th, we have a benchmark of 80% on each of the 4 measures. We reached 91.69% for court order rate. Paternity establishment rate was 119.23%. That can be over 100% because it matches how many cases need to be established at the beginning of the fiscal year compared to the end, so you can actually get more than 100% on that. Current support rate, 79.61%. We did increase on that. While we didn't reach the benchmark, the statewide average for current support collection is 74%. So we are above the state average. Same with arrears collection. We didn't quite meet the 80%. We did increase from last year, and the state average is 67%. I also wanted to talk about our strategic initiatives that we are working on. This is our mission statement. The child support program helps families become more independent and remain self-sufficient by establishing paternity and obtaining and enforcing court orders for child support and medical support. So I have 4 initiatives. First one is provide child support services. That would be by maintaining our performance standards in each of those areas, providing customer service through case management and website and social media. The second one would be to stay current on mandated programs and innovation. Right now, the state is working on a web-based program called We Kids, and that's set to hopefully roll out in 2017. Also coming up would be e-filing, which will be mandated soon, and also going paperless as much as possible. The third one is staying current on legal and procedural changes. We would do that by the training and development, both supervisor and staff training, attending conferences and encouraging the staff to attend conferences as well if we are able to. Also the Wisconsin Child Support Enforcement Association involvement. I routinely attend their board meetings, so I'm able to keep up on the happenings and what's going on. And the last initiative I have is ensuring financial responsibility. This would be by maintaining our performance standards because we get funding reflected on how well we do, and if we increase our performance from the following year, we can obtain more funding. Reporting expenditures appropriately so we get our reimbursements at the 66%. Collecting client fees through payment histories and court order fee collections. We upfront cost of process service and genetic testing, and then getting that court ordered for repayment would help our finances as well. So, and that is it unless you have any questions.
Any questions for Kim? Dennis?
Thank you.
Thank you, Kim. Next presentation that we will hear from tonight at Veteran Services Office, annual report. Bill?
Fantastic. Thank you for having me. You should have in front of you a 2014 annual report. Any questions? No, I'm not going to let you off that easy. Sorry. I did publish a report. I'm not going to bore you with a lot of facts and figures and numbers and things like that. I just kind of want to give you a feel for where we stood last year and where we're at right now and where we're heading. We manage about 8,153 records for about 2,800 veterans. A little bit of ambiguity surrounding the actual number of veterans in the county. The veterans self-report through the census, and that's how the VA gets their numbers. And then they just throw an algorithm at it that says normal birth and death rates. If we actually take a look at how many new veterans walk in the door and how many have died or moved in the last year, VA is projecting right now that we have about 2,447 in the county. I count closer to 2,800. My gut tells me with a bunch of unreported Vietnam vets that we're actually closer to 3,200, somewhere right in there. In 2014, I met directly with 731 different veterans, resulting in about 9,000 traceable actions. Those are actual end products, claims, things like that. One big trend we've been tracking over the last several years, and I think you've seen this in the annual reports, is an increasingly lower utilization of Wisconsin Department of Veterans Affairs benefits. A few things are coming into play there. I'm going to go into a little more detail on those here in an upcoming slide. One of the great things that happened in 2014 was the modification of the Wisconsin GI Bill. Wisconsin GI Bill is attendance at a University of Wisconsin college or technical college for the veteran, and they waive the tuition and segregated fees for that course. No money actually changes hands, so the UW system really despises this benefit because it's an unfunded mandate. They just simply cannot charge that veteran. In 2014, it was restricted to veterans who had entered active duty from the state of Wisconsin. In 2014, that changed. If a veteran comes in from another state, establishes residency here for 5 years, they can now utilize that benefit. And in 2014, we came in about $6,500 under budget. Next slide. Some highlights. Had the dubious honor of being elected to the first vice president of the CVSO Association of Wisconsin. Had I known what a roller coaster that was going to be, I might have thought again about throwing my name in that hat. I did complete 5 years of training with the National Association of County Veteran Service Officers. That's a bit of a higher level training than can be found here in the state of Wisconsin, and really opens some doors for prosecution of claims. Here's where I'm going to try not to speak out of school too much here. We have noticed a definite trend in the Wisconsin Department of Veterans Affairs taking action to erode the influence and effectiveness of county veteran service officers. Most of this is through the draconian application of statutes in the determination of eligibility for benefits rather than the liberal application of VA 8.01, which lets them interpret statutes to a veteran's benefit. We're seeing things like forcing someone to apply for food share to get glasses through an aid to needy veterans grant because the statute says must apply for all applicable aid. How food share is applicable to glasses, I don't know. But these are trends we've been noticing with this state agency for a couple of years. Based on that trend, and as part of the state leadership team for the CVSO Association, we initiated interaction with the Wisconsin Counties Association, trying to repair, improve, or address that relationship between the Wisconsin Department of Veterans Affairs and CVSO statewide. Where we're at right now, I couldn't believe it when I looked at the budget today. Looking at actually coming in about 10 grand under budget. I'm sorry, I'm pretty bamboozled by that because my budget isn't that much. So coming in 10 grand under budget is pretty huge. Right now, I was elected in October to be the president of the CVSO Association Wisconsin. What's that Chinese curse? May you live in interesting times. Yeah, we're there. Last year, earlier this year, I did begin CVA certification. CVA is Certified Veterans Advocate. It's about 5 years of pretty intense study and a service project that improves something for veterans, either statewide or nationally. I was approached by the National Association of County Veteran Service Officers to be part of their Washington legislative team. Given the hat I'm already wearing as the president and the work that's taking, I had to decline, but that may be something I'm looking at in a few years. The policy changes at Wisconsin Department of Veterans Affairs really began to impact local offices. There was a move in April by the Wisconsin Department of Veterans Affairs to basically rescind the state assistance to county veteran service offices. They approached the Wisconsin Counties Association and said, we want to do away with the CVSO grant. WCA basically said, why would we move to remove state funds from county government? Hard on the heels of that, they implemented a new policy which stated that a county would, with the grant application, would have to support the hiring of the veteran. They would have to provide a copy of the civil service exam and the scores. They would have to provide the newspaper articles that advertised the position. They would have to provide all the records of the process to hire that county veteran service officer. It was a pretty unrealistic evidentiary requirement. Given that the state retention schedule only requires even the Office of Public Employment to maintain those records for 3 years, I was hired 6 years ago. The potential for those records to actually surface was pretty nil. So it was a really good end around for WDVA to basically deny the grants carte blanche. We approached Wisconsin Counties Association with this. 11th hour deal made a change to through the Joint Finance Committee. It basically grandfathered all currently hired CVSOs to receipt of the grant. However, it's one of these things. Be careful what you put on the legislative table. You never know who's going to come to eat and how much they're going to take. WDVA took the opportunity through the Joint Finance Committee to change the entire structure of the grant to a reimbursement and put in play some very restrictive reimbursement policies that basically rendered the grant nearly useless. We're trying to address that now through legislative action. Based on this and the actions that were taken through Wisconsin Counties Association and networking with some key legislation, we are seeing some changes at the leadership level of the Wisconsin Department of Veterans Affairs. More to come. It'll probably be in the news. All right, where we're going. Trying to get to a paperless office. Running into some roadblocks. Big one is the actual time it takes to digitize all of the information in a record, scan it, shred it, get rid of it. Really looking at early next year getting some part-time help in to see just how much effort it's going to take if we have somebody dedicated to that task. We are starting to realize some real benefit through the electronic environment. We are slowing down the paperwork growth in the office, and basically we've cut the use of paper and office supplies in half since 2014. Seeing an uptick in new veterans. This is a double-edged sword. I was really worried because I was not getting OEF veterans into my office. These are veterans who are usually computer savvy and usually won't use somebody else's assistance if they can do it themselves until they mess it up. So now they're coming in to say, hey, fix this. wouldn't be so tough if these were a bunch of World War II vets, Korean War vets. You know, they'd come in with one or two contentions, they'd get shot or blown up, and it's pretty easy to do those claims. The complexity of OEF, OIF veterans based on the exposures that they suffered, far more complex claims. We're talking 11 to 13 contentions each, rather than the one or two that you would see from the World War II or Korean War vets. And because these contentions are usually based on toxic exposures, the burden of evidence that you have to gather and the expert medical testimony to support those claims, it's a much more complicated process. We are starting to leverage more technology to reduce the overall paper footprint. Now folks are coming in and they sign something digitally. It's stored in the computer, and we never even produce a piece of paper except to send to the VA. I think that's going to be on the next slide. I just talked about the increasing complexity of claims actions. We really do need to evaluate in the office the need for additional staff, whether this is temporary or ongoing. One of the big, there we go. There's still no electronic means to submit a claim. Although the VA has been really touting their electronic functionality for the last several years, and we've been hooked up to their electronic systems for the last 2, there is still no way for my office to sit down and digitally submit a claim. So I can do it in my office digitally. I have to turn it into paper and mail it to the VA. That's just ridiculous. There were some changes in law surrounding VA healthcare in 2014 that are really causing some headaches. Veterans' choice, basically following the healthcare scandal, where veterans were literally dying waiting to get into VA healthcare. Congress, in a knee-jerk reaction, passed a law called Veterans' Choice, which was supposed to allow veterans who lived more than 40 miles from a VA facility or had to wait more than 30 days for a VA appointment. It would allow them to seek care locally. They hired an outside agency, HealthNet Federal Services, to manage this program and to find providers. When it was put into law, they were paying less than Medicaid rates, so providers weren't really keen to hop on board. And HealthNet Federal Services, let's just put it this way, I put in for an appointment through the VA and through Choice just to see what would happen. I had my VA appointment in 34 days, and I'm still waiting for my Choice appointment, and that was probably 3 months ago. It's a broken system. It was fixable until they passed another law called Choice First, July 31st of 2015. Choice, so now we have VA healthcare, VA Choice, and VA Choice First. And that's all along with the programs that the VA already had, non-VA care, fee basis, community care. Those were all programs that the VA could already utilize to get somebody care in the community. So we've got about 5 or 6 different avenues for a veteran to gain care through the community. And really nobody knows how they work together. This just in, on Monday I received a piece of legislation about an inch thick, which is taking all of these programs and uniting them under one umbrella. It's a VA proposal to Congress, and they handed it to me on Monday and said, hey, we need your comments by Friday. So I'm working on that. We'll see. The whole idea behind it, as it stands right now, is they're just going to basically say, if you can't get here if we can't get you in 30 days and you have to travel more than 40 miles, basically you're gonna be seen under this one individual new choice program, and we're gonna pay for it. So it's basically turning a chunk of the VA into insurance. I think that's not a bad idea. I just need to see some real commitment to improving the current process. Next. All right, so long, slow slog towards a paperless environment. I've got, I couldn't even tell you how many lateral feet of paper to turn into digits, and 2 people in the office with an increasing workload. I had somebody come in from outside and do a quick once-over on what it would cost to have an outside company come in and digitize, and they said somewhere between $15,000 and $30,000. I said, yeah, that's a third of my budget. No thanks. So we're looking at how to do it internally. We're making some headway. I think we got through all our World War I vets, and working on our deceased veterans, but we'll get there. I'm looking at the increased workload, the uptick in what we've been doing, and some comparisons with other CVSO offices. And 2013, 2014, what Dawn and I are producing is on par with some offices that have 4 to 5 staff members. So not yet. Maybe next year I might be approaching the board and say, hey, I need another person. So just to prepare you for that. I believe that is what I've got, barring any questions. Fire away.
I'm not sure how to ask this, but your problems, is that state or are we talking feds? Or both?
If we're talking the policy, it's state level. It's being addressed. The deputy secretary was fired 2 weeks ago, and pretty strong suggestion that the SEC might not make it to the first of the year. I'm meeting with Wisconsin County Association leadership this Friday to come up with a strategy to reform the grant. My intent is to remove it from that agency's influence.
Any other questions for Bill? Very much so.
For all he does for the county.
It's my privilege. Thank you.
Thank you, Bill. Thanks, Bill. Okay, that concludes the presentations tonight. This next thing on the agenda is discussion and action item, HIPAA security analyst.
So in 1996, the federal government passed a law, known now as to everybody as HIPAA, the Health Insurance Portability and Accountability Act. It basically deals with electronic healthcare information, and the county is covered under that. In some areas, we're called a hybrid entity because we have some departments
start working on this, Ruth?
Just about a year.
See Wade Rasmussen is listed on here, who's not here anymore.
Yes, there are people who were part of the work group who are no longer employed by us.
I noticed Brenda Ruby also.
Brenda Ruby, Wade Rasmussen, and so we did start this process, I think it was about a year ago. We probably had about half a dozen meetings. I sent them back with like work to do to bring back from the departments. We had to do a complete inventory of all of our IT, where they're storing everything. If we're looking at common servers, we're looking at, we're looking at laptop versus wireless, and we're looking at paper files. When people go into the field, are they taking a tablet with them? Are they taking a laptop with them? Are they taking a paper file? If I'm in a client's house, what do I have with me that might have information that I might need to use? It just their information, or is there other people's information? So it was a lengthy process.
Then the committee, did you shape this risk assessment threat source list just to our county, or was this something used by other agencies as well?
We got the basic tool from an entity called HIPAA-COW, which is a coalition in Wisconsin that is a bunch of different people who have HIPAA experience, and they meet together as work groups. They put together different templates that entities can use as long as they're acknowledged in it. So that's why sometimes you'll see names in here that say HIPAA-COW on them, because we took some of their work product, but then our actual threat list has been modified just to Washera County. We did eliminate some things that we thought that there was really not a threat in Washera County. For example, a hurricane, we took hurricane right off the list. We really didn't think we were susceptible to a hurricane.
Glaciers, you're worried about those too?
That one wasn't on the list. I might want that one on there. So we did tailor it then to our county.
I think you did a really good job. I'd like to make a motion to approve the security analysis.
We have a motion, is there a second?
I'll second.
Motion made by Dennis, seconded by Barry to approve this HIPAA security analysis. Is there any further discussion or questions on it? Larry? If not, all in favor?
Aye.
Opposed? Carried. Next thing on the agenda is consideration and possible action on the following resolutions and ordinances.
Resolution number 34-11-15, resolution approving the Washera County 2016 budget appropriation.
Motion made by Everett. Is there a second?
I'll second it.
Made by Everett. Seconded by Bob. Any discussion? Yes, Larry.
The Personnel Committee recently put the health insurance for the county employees up for bids, and that we received 7 bids, and the best bid we had was like 13.4% less than what we have been paying the previous year, or for 2015. And if we were to accept that bid, we'd be saving like $360-some thousand. The second lowest bid was like 12.8% less than what you're currently paying. And I'm wondering if the budget can't be adjusted to reflect that. We haven't definitely selected a health insurance company at this point. We'll be meeting soon to do that. But it looks like we've narrowed it down to either one of those 2 companies, depending upon what hospitals and doctor groups that they would accept, and what the co-pays would be, and look at some of the details about each one before we decide. But it seems that we could reduce the budget by a significant amount to reflect that reduction. And it would reduce the amount of increase that would be in the tax levy. What do you think about that, Ruth?
I think it's possible. So tonight would be the night that you would need to do that, because then the finalized budget has to be to,
We basically need to have all the apportionment calculations completed and out to municipalities by Friday and to the state by Friday. So this would be a very involved process if we have to go through each budget and decrease health insurance costs, or I don't know how we would do it that way.
Would the savings just roll over into the
well, what
general
would
fund?
happen is if there was, if the full amount wasn't spent by the budgets, at the end of the year, it would go to the general fund.
Right.
But, if, you certainly could take it out tonight. I don't know what amount you would take out for sure. But you could take out something.
Bob?
Is that, Larry, is that a one-time deal, or is that gonna continue year after year, or is there no way to tell?
This is budget, this is a contract for 1 year. We don't know, but,
And one of the groups said that they would not increase it more than 9% next year,
right.
guarantee.
So there is hope that there may be some savings down the
Future
road.
years too.
Yeah, that's what I was getting at.
So about 5 years ago, the county board agreed to hire, a broker, type person who has, we have a company called Hayes
Hayes.
that, is, they're worth every dime that we spent on them. They, do all the analysis for us, they help us with our ACA, our
just take a flat amount, like 300,000, reduce the budget by 300,000, and we would still have some surplus available depending upon which company we go with. We may not go with the cheapest one. You know, cheapest one is not always the best. We got to look at what coverage they provide for our employees, what benefits. So I would like to make an amendment to the motion to reduce the budget by 300,000.
I'd like to discuss it further.
Pardon?
I'd like to discuss it further.
We don't even have a second yet.
Yeah, I seconded it.
No, but a second by amendment.
Oh, okay.
Larry's made an amendment to that. Is there a second to that?
I'll second it.
A motion made by Larry, seconded by Russell, to add the amendment to this resolution. Further discussion?
We have to come back in the middle of the year and wheel and deal on this insurance. We have no idea how much that will cost us, correct?
It would not be the middle of the year. It would be next budget.
Next budget.
Yeah. So the agreement that we make with the insurance company is for all of the company is 2016. The agreement that the insurance company has with the providers, we don't have any control over, but they will do our plan. They might change our providers. So that was the concern with our current plan is that they would give us a 0% increase. We would have the same exact plan that we have now, but come July, some of the providers may no longer be covered. So you would still have that plan, you would just have to go to a different provider. If we switch plans, then these two plans that we're talking about are fairly new things. Arise has been all over TV. I've heard it on the radio, and I don't remember what the Humana one is called, but they're fairly new conglomerations of doctors providing this new type of care. Hayes has indicated to us that because it's a brand new offering, that those doctors and those groups are probably set for 4 years, because when doctors sign on to a thing, it's usually a multi-year agreement that they're going to be part of that. So if we switch companies, there won't be a change in doctors. But whatever plan we agree to, our costs won't go up until the next year.
The Humana plan is called Athena.
Do these plans, I heard someone say a little bit ago that in the near future, Theta Care may not be included in these plans. And Theta Care, it seems to me, is pretty big in this area.
That was only for our current one.
For our current one. Our current one has indicated, well, Network Health won't say anything, give us an answer. They're saying that they're still under negotiations.
But Theta Care has said that.
Hayes reached out to Theta Care, and apparently Theta Care has also put stuff in the media that they are probably not going to be affiliated with Network Health come July when their current contract is up. But that's our current plan. That's not one of the plans that the Personnel Committee is considering.
What's your current plan?
Our current plan is through Network Health.
Network Health? Okay. I have that insurance, and I'm finding out that they're eliminating a lot of services
just wondering why this took so long to find this out and putting the clerk and everybody under such constraints to get this all done in a week's time. It sounds kinda,
We just got the bids a few days ago.
but why wasn't it let out sooner than Larry?
Well, it
Or
was.
negotiated, or,
It took a while. You have to give them time to submit the bids for one thing. It was put out in September, I think, wasn't
We
it?
have been working on this for a while.
they just dragged their feet?
What did you give them for a timetable on to have their bids in by?
We are meeting next Tuesday, I think, at 1.
Yep.
I mean, initially, when you asked for the bids, when did you put out for a,
So originally, we were working with our current healthcare provider, and then when they came back with it, then we met to talk about what do we do, and then we put it out for bids, and then we met last week, with the bids, and then the personnel committee sent it back to ask some questions. For instance, Arise had said that they would guarantee a 9% cap. So one, so Arise is part of Blue Cross Blue Shield. Arise itself has this pocket of providers, so it's Aspirus Community Health, Medicare, but it doesn't include affinity clinics, and it doesn't include ministry, and it doesn't include some other things. One of the things that Blue Cross Blue Shield offered to us is that you could offer a dual plan where you could have some people on Arise and you could have some people on their full plan, which is the entire state basically, and it has all these other doctors. They're two different costs. So one of the questions that the committee had that Blue Cross Blue Shield needed to clarify was if you had people on this full plan, how much, there's like a formula under the ACA that the employee would have to contribute in order for that to be feasible. And so then it would be whether or not that was feasible for us. So we needed to get that additional number. Then they had said that they would guarantee no more than a 9% increase for year 2. So then we need to know, does that 9% cover just the Arise portion, which is this new product that's trying to manage healthcare costs, or does it include both products? Humana only offered their managed care product, which was the 12% increase, but they also have a larger network thing, and so the personnel committee wanted to know, well, how much is the cost for that, and was they do a cap for a second year, because they hadn't offered us a cap for the second year. So it's like they give you this much, and then when you start asking more questions, you need to go back to them. So we met last week, and we're meeting again next week, and hopefully we'll have all the answers.
So what we're at, if they would go with that 13%, you'd save that this year, or for 2016, but in 2017, you'd only save 4%, because the potential is there, they could go up to 9%.
It could go up
Correct.
9%, but it would still be less than what we paid in 2015.
Okay,
It'll be a savings.
But we're not obligated to stay with them any longer than 1 year.
just a 1-year contract?
Yes.
Okay,
with that broker, you can go back to the table every year and try to see what you can save.
Right.
So.
If this amendment were to pass, does this mean that the budget would have to be adjusted in every department by Friday of this week?
And Deb is not here who handles those calculations. She's on vacation, so I don't know how we would get this
That
accomplished.
puts it pretty tight.
We're gonna run into this every year. The health insurance bids come in very late, and so we're gonna be running into this situation every year, and it's really very, very late to make adjustments at this point. It's not just a snap of the fingers and everything's taken care of. It's hours and hours and hours of work. No.
Not spending it.
No, it
It's
would
still,
go back to
it
the
would go
general
back
fund.
into the general fund. So, what?
There's a tax increase in this budget. That's the difference.
It would reduce the tax increase. That's what I'm trying to do.
Yeah.
Right.
Or the,
But we have to have somebody that can do this, and we're not sure whether it can possibly be done.
It'll get done.
In 3 days?
Come on.
We would find a way to do that, if that's what you want.
I have all the faith in the world in that lady right there, so if she said she can get it done, she can get it done.
Sarah and I will be
you gotta put company against company, but everybody comes in late.
And I think it's not a matter of, we know the savings there. I think the largest, who we're representing here are the people in our district, and if it means reducing the levy, then I think it's our responsibility to try to get it done. That's the bottom line.
Okay, any more discussion here?
Is there any way you can figure each delivery?
This
Close
meeting
to
is
half.
typically just, kind of a
Close to half of what the
finalization,
increase
so
in
I'm not
previous was.
prepared to do any of those calculations tonight. And quite honestly, if our previous budget finance supervisor of many years was put on the spot like this, she probably would have retired way earlier. It's pretty much unheard of that we make changes this late in the process. It's just kind of rough.
We have to act on the amendment first, don't we?
Yep, there's a motion and a second.
A motion and a second on the amendment that Larry has suggested. This should be just an aye. Roll call.
Mr. Heisey?
Yes?
Mr. Tim?
Yes.
Mr. Mastrocola?
Yes.
Mr. Eckstein?
Yes.
Mr. Wedding?
No.
Mr. King?
Yes.
Mr. Wato?
No.
Mr. Rothermel?
Yes.
Chuck Kirschner?
Yes.
So that's 1, 2, 3, 4, 5, 6, 7 yeses, 2 nays, 2 absent. So does that fail, Ruth? Because it's not a 2/3 majority?
It's only the approval of the full budget that needs to be.
Okay, so this,
Just the amendment motion.
okay.
Now we'll take a roll call vote on the 2016 budget appropriation as amended, yes.
Okay. Mr. Tim?
Yes.
Mr. Mastrocola?
Yes.
Mr. Eckstein?
Yes.
Mr. Wedding?
Yes.
Mr. King?
Yes.
Mr. Wato?
Yes.
Mr. Rothermel?
Yes.
Mr. Kirschner?
Yes.
Mr. Heisey?
Yes.
9 ayes. Resolution number 35-11-15, resolution requesting monetary assistance from the United States government to offset the costs of county veteran service offices providing Department of Veterans Affairs outreach and claims preparation services.
Motion approved.
Second?
Motion made by Bob, seconded by Jerry to approve the resolution. Any discussion or questions on it? If not, all in favor?
Aye.
Opposed? Carried.
Resolution number 36-11-15, establishing service of process fee to be charged pursuant to section 814.705 Wisconsin state statutes.
Motion to approve.
A motion made by Dennis. Is there a second? Seconded by Everett. A motion and a second for this resolution. Discussion? Questions? If not, all in favor?
Aye.
Opposed?
Resolution number 37-11-15, resolution authorizing cancellation of outstanding checks, Sheriff's Department.
So moved.
Second.
Motion made by Jerry, seconded by Bob to approve the resolution. Any questions or discussion on it? If not, all in favor?
Aye.
Opposed?
Ordinance number 590, ordinance amending Washera County zoning maps pursuant to the authority granted in Chapter 58 Washera County Code, zone change, Daniel and Linda Bash, Town of Watoma.
Motion to approve.
Second.
Motion made by Bob, seconded by Dennis to approve. Any discussion or questions on it? If not, all in favor?
Aye.
Opposed? Board suggestions for future agenda items.
if I could share, I do have a few announcements that I'd like to.
You go right
Okay,
ahead.
very quickly. First of all, you've noticed Bernadette's not here tonight. She had an accident on the farm and she's in the hospital since Friday. So she's going to be out of commission at least for 2 weeks, but full recovery could take several months. So she's at Mercy Hospital in Oshkosh at the time. So if we hear anything, we'll let you know. But she has a broken nose and a bruised spinal cord that they're concerned about. So the second thing that I have is an invitation from the Honorable Guy Dutcher, requests your presence at the Waushara County Treatment and Diversion Court to celebrate the graduation of 3 participants. This is on November 19th. I believe that's next Thursday. At 10:30 a.m. at the courthouse here in Watoma. So you're all invited to that. And the last thing is our Register of Deeds, Heather Shresenska, and some of you that with email should have already gotten this notification, but she is celebrating the recording of the 500,000th document in Waushara County that was recorded earlier this month, and she's having a little celebration treats tomorrow after 10 a.m. for that. So you're all welcome to invite to attend that in the Register of Deeds office as well.
Anything else, Mel?
That's all I got.
Do I look like I need treats?
None of us need treats.
There's no other suggestions or future agenda items. Everett, it's yours. There's a second. Seconded by Larry. Motion made by Everett, seconded by Larry to adjourn. All in favor?
Aye.
Opposed? Carried. Thank you.
Well done, Larry.
Well, bring some of that meat home.
I'm gonna.
That's right, he's checking out, he's leaving next,
Tomorrow.
Jason, elk or moose or something.
Muleys.
Muley.
So far, we haven't had one.
And that's been about 3 months ago. Yeah. You know, I haven't used that.
Better than last year. Last year was 18, 20 below when we got there.
We got probably
You
the
leave
most
that weather out there for a couple weeks yet, couple months yet.
This year it's supposed to be.